All right, welcome back in. Earlier in the newscast, we told you about damaged hearing from wearing headphones. Now, that's something that we do see a lot these days with wireless technology. So with that in mind, we're going to be talking today with Jennifer McInnish, who is an audiologist at Princeton ENT. How you doing?
I'm good. Thanks for having me.
Okay, well, we mentioned, we reported on this case, and I know you don't know much about that case, but do you see more with people with hearing damage these days now caused by listening too loud with earbuds in?
We do. We're getting younger and younger people in the office with hearing loss, significant hearing loss. And a lot of it is because our world is so much noisier. I mean, we walk around with earbuds in our ears and it's up in the 80 decibel range and it's constant. So we certainly are getting more younger and younger people with hearing loss.
Yeah, well, May is Better Speech and Hearing Month. And of course, there's some statistics out there where nearly 16% of adults in the U.S. Report hearing some sort of trouble. So I want to ask, what are some of the signs that people might be going through some sort of hearing loss?
Well, it's important to catch hearing loss early, and that's usually what we miss are those early signs. Everyone knows when they can't communicate or when they stop being able to hear the TV or the phone, but really some of the early signs that people miss is fatigue. Whenever you're in a large crowd of people and you suddenly feel really tired afterwards, social situations. Also, misunderstanding children, the way our hearing works. Your high frequencies or the high pitched sounds tend to go first, so people will misunderstand children sometimes or lose an S sound or an H sound. I always tell my patients that the people will sound like Charlie Brown's teacher whenever you're in a group because you miss all those consonant sounds, and that's really when it's past time to come in and get an evaluation.
Yeah, and I guess it's like anything else. It's best to catch it earlier rather than later. That's
Very
important,
much.
isn't it?
Very much so.
Yeah,
absolutely.
So what will you do if you are? What are the results, I should say, of an undiagnosed hearing loss?
Well, we all know that you use hearing loss for communication, and we all know what the lack of communication can cause: isolation and depression. But your hearing loss is also, or your hearing is also working all the time, whether you're communicating or not. You're getting neural stimulation. If you're asleep on the couch and the dog comes in, your ears are hearing the jingle and sending information to the brain. So all these neural pathways are constantly getting stimulation. And as you lose hearing, you're not getting that stimulation anymore. And that leads to cognitive decline and memory issues and all kinds of compounding things. It's really recommended that you get your hearing test once a year, just like you get your eye exam.
Yeah, so we're talking with audiologist Jennifer McInnish. Now, we've talked about that now. What can be done to improve? How do you treat it?
Well, it's important to go to the doctor once a year and get your hearing tested.
Right.
There are sometimes things we can do medically if there's fluid in the ears, but most of the time when you get hearing loss, the treatment for it is hearing aids. Even mild hearing loss can be treated with hearing aids. But it's important to go to your doctor's office and get that evaluated prior to any discussion of hearing aids.
There you go. Hey, good information right there. Jennifer McInnish, thank you so much for joining us this afternoon. We certainly do appreciate your time.
Thanks for having me.
All right, nicely done. All right, coming up, continue.